All right, so vertigo and vestibular disorders. About a month ago, I had someone call me because they had some chronic vestibular issues. We all know how important our eyes and ears are when we balance, right? When we go through the assessments and we close our eyes, boy, isn't that a difference versus having our eyes open. When we take away one of those systems, our eyes, our ears are not functioning properly, we depend on other systems like mechanoreceptors at the bottom of our feet that detect pressure, proprioceptors in our epidermis, in our skin, that tell our brains where our limbs are in space and time. For those that have had the unfortunate experience of having an amputation, sometimes they will experience what's called phantom limb pain because their brain is trying to connect to those proprioceptors that are no longer there. So what you're looking at is how many people suffer from vertigo in the United States. It's over 61.2 million, right? And that is chronic and that is acute, right? Sometimes it stays. This person calling me was looking for a vestibular specialist, a physical therapist that has gone through school or gone through a course and learned how to treat this vertigo because it's that severe. The Epley Maneuver will not fix it. If you are in that boat, I am sorry. I know vertigo I've never experienced. I pray that I don't, but I have seen plenty of people who have. And what that is when these magic crystals or mythical crystals get a little dislodged and out of place in your ear, and you're having to go side to side on the bed to get those crystals back in place. It just goes to show how important it is for you guys to get your eyes and ears checked every year, at least once a year. Get your eyes and ears checked. We were able to connect this gentleman to a therapist after a couple of weeks. I worked with him twice, and it was pretty rough, you know. But here's the deal. At the end of the day, suffering from things like vertigo and vestibular disorders increases your risk for a fall by 12-fold. So that's a pretty big increase, right? So let me just reiterate, guys, if you're experiencing that, there's resources for you, and get your eyes and ears checked at least once a year, all right? With that being said, let's stand, let's go behind those chairs, let's get rocking and rolling.